Hey, it's Scott. And in this week's Give Me Five, it is best described as Flashback Friday. Because this afternoon, I'm lucky enough to be joined by Craig Felty, who, when you look back in the day, was my first charge nurse in the ER, followed by flipping roles. I was his first preceptor on the helicopter. Jumping a couple years later, he became my chief flight nurse on the same helicopter. And then, since then, Craig has gone on to be a CNO and a hospital administrator at several sites across the country for the past several years. And in this Give Me Five, Craig and I just wanted to touch on things that, from an administrator perspective, that people tend to get sued for. The first of which, Craig, is x-rays.
Yeah, Scott. So it's a typical thing that I see primarily with some of the med-legal ER cases that I do. And generally it's the hospitals and the staff not having a appropriate process for follow-ups of x-rays. So you get a kid or adult or kid, really it's all ages, that comes to the emergency room. They got a little spot or something on their lung that shows up on a chest x-ray that might be done to rule out pneumonia or something like that. And it's what we call an incidental finding. And generally what would happen is the radiologist would overread that, would maybe notice that the ER physician didn't notice, and then they would call the ER to let them know that incidental findings there, it's going to require some outpatient follow-up just to make sure that there's nothing bad. And fortunately, a lot of those are not happening. The process has fallen. We've always had the process and need to do that, but it's fallen to the wayside. ERs are busier, whatever the case. EMRs might be part of it, but that's not happening. And unfortunately, there are a lot of bad cases out there. I know you have experienced some too, that where these patients show up 18, 24, 36, 5 years later, and they got stage 4 metastatic lung cancer, and it's causes badness. So, and it could have been prevented possibly just by assuring the patient was aware and that there was appropriate follow-up done.
So, as you touched on, certainly on the big people side, you hear the tragic cases of somebody who shows up, they get a chest x-ray for whatever reason, they happen to see something, which years later turns out to be something really, really bad, but it never got communicated to the patient. The same idea applies in the ER when it comes to kids, because even if it's something as simple as you do an x-ray because they may or may not have broken their wrist, and one person takes a look and says, you know what, at first glance it doesn't really look broken. The radiologist comes in the next day during normal hours and looks and says, yes, it's broken, and may or may not communicate that to the ER / may or may not be communicated to the family.
Right.
So with that, just whether it's an x-ray, as we'll touch on in just a moment, for lab work, the same idea, yeah. You have to have some sort of a way to actually document that this was passed from this person to this person and down the road to the family as well. Labs, the number 2 one we came up with.
Yes, and probably more appropriate for kids is the labs, and it's extremely important. Really, blood cultures is probably the most common one that I see. You see some wound culture ones too, but more common blood cultures because they can become very sick very fast. Blood cultures are drawn, and kid comes ER febrile, as a maybe rule out viral syndrome, whatever. They draw a CBC, they draw a blood culture. Obviously, the blood culture is not going to come back. Even a preliminary not going to get for at least 24 hours. But if that comes back positive, there's got to be a mechanism in order to either call the patient or call the patient's primary care doc to let them know that they got a positive blood culture, because that kid can get very sick very fast with that. And that obviously means that the patient has bacteria in their blood that is growing. And so unfortunately, I've had a few cases where I've had bad outcomes from that. So it's the same thing, assuring that you have that process in place to always notify the patient, but then also notify the patient's primary care doctor, whoever you gave them for follow-up also, so that somebody can assure that they're treating that kid. Or even better, if it's a positive blood culture, it might be better off just having the kid come back to the emergency room in order to get some IV antibiotics in them to kind of get that thing squelched before it really takes over.
So from an administrator perspective, when Craig and I were talking this afternoon, that really is 2 of the biggest things. And if you notice the trend, it's all just about follow-up. It's somebody passes it on to somebody passes it on to somebody. And whether it's a phone call that you actually leave a message on their answer machine, some places will mail them a letter, some places will mail them a certified letter with return receipt, so that there's some way on paper that you can absolutely document that indeed every effort was made to follow up. Because whether it's an x-ray or a blood culture, I mean, bad stuff can happen. And especially when it comes to court, remember, attorneys will battle for days upon days about the whole idea of if you didn't document it, you didn't do it. But from this perspective, whether it's for blood cultures or for x-rays, follow-up absolutely is the key, because 4 years later, when indeed it does go to court, regrettably, if you didn't document it, you may or may not have actually done it.